This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
We've got to face it, it's a fact of life. As we age, our bodies start to show a little wear and tear, and that includes our eyes. Most of us have had to reach for the reading glasses as we hit the 40s and the 50s. But why? And why do some people seem to have no problem seeing up close? Well, we hit up Dr. Jason Yonker of Chesapeake Eye Center for some answers.
Presbyopia, a big name for a common problem.
So essentially, presbyopia is like a mouthful, but essentially what it means is it's your loss of your ability to read up close as you get older. It's, in a nutshell.
Dr. Jason Yonker of Chesapeake Eye Center says it's the most common complaint that he hears from patients.
So the first thing patients notice with presbyopia is going to say your arms start stretching out when you're reading. So you start being able to read close, and then you're reaching out further and further. Or patients might say, I'm having to increase the font size on my computer, or I'm having to increase the font size on my phone, which luckily nowadays with devices we're able to bump font sizes.
Dr. Yonker says presbyopia is inevitable for most people. Some who wear glasses for nearsightedness or the ability to see far away at a young age don't end up with it.
What that means is that person has a natural focal point in their eye that, let's say, you can see clearly this close. Well, you'll always be able to see clearly that close, and you're never going to be able to see far away. So your nearsightedness never really progresses once you're an adult, but your farsightedness theoretically can because of the lens changes. So it's tricky because nearsighted patients don't really suffer presbyopia as much because they can take their glasses off and they can still read clear.
Reading glasses are the most common treatment for presbyopia, but Dr. Yonker says some people who have never worn glasses in their life can end up needing bifocals later in life.
So you're going to have one section for mid-range reading and one section for near-range reading. The progressive kind of blends it all together. So the first and easiest way would be glasses. Contact lenses are another option. The very good contact lenses out there that are called multifocal contact lenses. So essentially they're all bifocal contacts, so they'll let you see distance and see reading at the same time.
If bifocal contacts are not a good fit for you, Dr. Yonker says patients can turn to what's called monovision.
So that's where one eye would be set for distance, one eye would be set for reading. Doesn't seem to do as well as the multifocal contacts, but that's another option for patients, is you can set one eye for reading, one eye for distance.
Although there is no cure for presbyopia, Dr. Yonker says there are some medications for it.
There's been a new drop on the market, and it's everywhere in our office. There's a Vuity drop, it's called. That is a drop that constricts your pupil, and it will induce some nearsightedness into your eye. So there's pros and cons with the drop. With the drop therapy, it's essentially a pilocarpine molecule that's been around for almost 100 years or so. The pros is if you're early on the onset of presbyopia, maybe you're in your 40s and you're just starting to lose your reading ability, this can add a little bit back in. But it does come with some side effects. There's a potential for some headache or a little bit of tightening around the eye muscles because it constricts one of the muscles inside your eye.
Another option comes with cataract surgery.
We can try to fix some of their presbyopia by implanting one of those multifocal contact lenses that we were talking about into their eye in the form of a lens implant. So when we take the cataract out, we put the lens implant in, and we can either set them permanently monovision, where one eye's distance, one eye's reading, or put a multifocal implant in their eye where they can see distance and maybe see another focal point in the near range. Glasses,
Contacts, medication, surgery, all alleviate the symptoms of a condition that there's no way to prevent.
I always tell my patients, no matter what I do, the eyes aren't going to be 20 years old again.
Now, both surgery and the eye drops that Dr. Yonker mentioned come with risks. He says neither is a one-size-fits-all option, so it's best to have a long discussion with your doctor.